Why do liver court scans need contrast dye? Imagine trying to see a busy city at night without any lights on. It's hard to tell where the buildings end and the streets begin. That's similar to what a liver scan looks like without contrast dye. The dye helps light up the liver and its blood vessels, making everything clearer. When doctors perform a liver-computed tomography scan, they want to see detailed images of the liver tissue, blood flow, and any unusual spots or growths. The contrast dye, which is usually iodine-based, is injected into a vein. It travels through the bloodstream and makes blood vessels and tissues appear brighter on the scan. This brightness difference helps radiologists distinguish between normal liver tissue and areas that might be abnormal, like tumors or lesions. The reason contrast dye is so important is because liver tumors, including liver cancer, often have different blood supply patterns than healthy tissue. For example, liver cancers tend to be hypervascular, meaning they have more blood flow. During the scan, the dye highlights these areas by making them stand out, especially during specific phases of imaging. The process involves taking multiple images at different times after the dye is injected. This dynamic imaging shows how the dye moves through the blood vessels and liver tissue, helping to identify abnormal growths more precisely. It also helps in determining the size, location, and blood supply of any tumors, which is crucial for planning treatment. Without contrast dye, the images would be less detailed, and it could be much harder to tell healthy tissue from abnormal areas. This could lead to misdiagnoses or less accurate assessments. Contrast-enhanced scans are considered a standard part of diagnosing liver conditions because they provide a clearer picture. They also help evaluate other liver issues, like cirrhosis or bile duct problems. Of course, using contrast dye isn't without risks. Some people might have allergic reactions, and in those with kidney problems, the dye could cause kidney damage. That's why healthcare providers carefully evaluate each patient's health before administering the dye. They might choose alternative imaging methods if necessary. In summary, contrast dye is essential in liver court scans because it enhances the visibility of blood vessels and abnormal tissues, making it easier for doctors to detect and evaluate liver cancer and other liver diseases accurately. This improved imaging helps guide effective treatment and management, ensuring patients receive the best care possible. Always remember to discuss any concerns with your healthcare provider, as they can tailor the imaging approach to your individual needs.